Good afternoon, everyone, and thank you so much for joining us today for our live video. My name is Gabby, joined here with Carly Rupiper from the Boys Town Pediatric Weight Management Spark Clinic. Carly, how are you today?
I'm good. Thanks for having me on today. I appreciate it.
Of course, thanks for joining. So we are going to be discussing a few things today in this live. It is the new year, so with that, many children and families are looking for ways to improve their overall health through diet and exercise. So we are going to be discussing some great tools to use in that journey, as well as highlighting something that has really been in the media lately, which I'm sure a lot of families have seen, and that is the use of medication, over-the-counter injectable medication for weight loss. So there's a lot of buzz about it, like I've mentioned. So we're kind of going to clear up maybe some rumors that we have going around it, why it would be used for some, not for others, and everything related to that. So if you have a question on any of the things that we discussed during this live, go ahead and leave it in the comment section and we can try and answer it here at the end. Okay, so the first question, Carly, is, like I said, it's the new year. So what tips does the Boys Town Pediatric Weight Management Spark Clinic have to share to help people reach those goals? And maybe before we answer that first question, would you mind, maybe for the people who have never seen our lives before, describe what the Pediatric Weight Management Clinic is and what we do there?
Yeah. So we're a multidisciplinary clinic that we have here at Boys Town, and we kind of look at this as all around comprehensive care to helping our families and our patients get healthier and just achieve better health in general. Maybe that's looking at our weight, our body size, but just having better health on the inside for the rest of our life is our main focus. And so my role as a nurse practitioner is focus on medically what's happening with that patient and what health issues they might have that we need to work on and concentrate on. We have a dietitian that focuses on making some healthier food changes. We have a behavioral therapist to work on maybe mental health conditions, but also just developing better habits in general. And we have a physical therapist that works on just improving our overall activity every day too. So we just look at all those things that are involved with getting healthier and supporting families with a better lifestyle.
Awesome. Thank you. So what tips do you have to help people reach their health and exercise goals in the new year?
Yeah, it's 'tis the season for New Year's resolutions. And one thing that we hear a lot is people say, like, I just want to be healthier. I want to lose weight. And sometimes those goals aren't specific enough. Like, what does better health mean to you? What does weight loss mean to you? Is it 5 pounds? Is it 10 pounds? How are we going to get there? So it's more about setting those small little goals that we need to achieve to get to that big goal. So if it's losing 5 pounds every month, okay, well, what are we physically going to change that gets us in that direction? So think about very specific yet small, realistic goals that aren't setting the bar too high. So maybe for somebody who just wants to get healthier, let's base that on, okay, every day I'm going to make sure I have a fruit and or a vegetable, or I'm going to at least get 15 minutes of walking in that day. So then once we can do those little things every day, that leads to success, and we can build on more goals on top of that too.
Yes, we love a measurable SMART goal. That's awesome.
Mhm.
So, this live is titled Healthy Weight Loss Toolbox. So, what tools should children and families keep in their toolbox to either lose weight or maintain a healthy weight?
Yeah, and there's a lot that we support our families with, because there's just lots of things that we just don't realize. Oh yeah, that would be helpful, or I never thought about this. But one thing I really enjoy talking to our families about is scheduling for the week and planning ahead for the week. I think one of the biggest barriers we hear our parents especially say is that we've got a lot of activities, a lot going on after school, and cooking meals is really hard, and so it leads to a lot of drive-through or picking up food. And so some of our most successful families sit down on Sundays for a few minutes, look at the weekly schedule and all the activities and appointments going on, and determine, okay, what night can I cook this? Or what night's going to be so busy that we will have to pick up something to eat? Or maybe designate a certain night as that's crock pot night because we're going to be barely home. Or maybe a certain night of the week is always taco night. And so you always know that we need to have those staples at home, and being prepared for that meal always on that night. So when we kind of we're prepared for the week, it leads to less, oh, I don't know what to cook. I don't know what I have on hand. Let's just drive through and pick up food. So any
Mhm.
meal we can make at home is generally always going to be healthier than what we get at a restaurant or fast food. So that's one of the tools that I really like to promote to our families lately, because life is busy and that's not going to slow down or probably get better either. So we kind of have to just manage that.
Yeah. And one thing I want to note too about the Pediatric Weight Management Spark Clinic is, they don't just focus on the physical body, they also focus kind of on the mental side. So, this tip, especially, of course, it will help with healthy eating habits throughout the week, but also it kind of takes that mental stress off of, oh my gosh, what am I going to cook tonight? I'm so stressed
Mhm.
out with planning. So, it's kind of a double ended thing, which
Yes,
you
yes.
mentioned that. Yes. Okay, so getting into the nitty-gritty of it, like I mentioned at the beginning, there's been a lot of buzz in the news about a specific tool in the toolbox for some, and that is the weight loss injectable drug. So they go by a few different names. I've heard Ozempic as one of them being mentioned in the news before, but that some are using to lose weight. Can you explain more about these and why they are being used?
Yeah. So these medications have been around for a little while, within the past 10 years or so. But these injectable medications were originally made for treatment for people with type 2 diabetes. And then they were noticing a really good side effect of a lot of weight loss sometimes for these people. And so then the FDA, Food and Drug Administration, did safety trials to see if we could label some of those medications just for the purpose of weight loss for adults. And then we've had those medications around for a few years. Adults have done pretty well with using that for some weight loss as an adjunct tool. And then more recently, we've looked at using these more for kids in the pediatric patient population. And what these medications specifically do is they target receptors within the GI system to kind of help our body regulate blood sugar control better, use our insulin hormone better, slow down how fast food moves through our GI system, and send a kind of feedback response to the brain, decreasing hunger overall. So we've had a medication in place for pediatric patients for weight loss that is an injectable, but these newer ones are showing a little bit more weight loss results and better health outcomes.
Mhm. Yeah, and I saw, within the last week or two that the FDA approved these drugs for use in patients 12 and up. So what does that mean? And do you think with this approval, will they be used more often?
Yes, I think so. That on top of like the social media buzz, there's just such a whirlwind now about these medications.
Yeah.
And unfortunately, these medications are intended to be used in their FDA approved for people with pretty more severe weight issues or obesity with health issues because of that. And then, of course, still are people with type 2 diabetes. But what has happened is a lot of celebrities are getting their hands on these medications to lose weight for cosmetic reasons and not because their health depends on it. And so this has definitely created a shortage. There's a short supply, unfortunately, for these medications. And the celebrities have the power to pay for them out of pocket because they're not the cheapest medications. Unfortunately, they don't go through insurance; they just pay cash. And but yeah, a lot more has been in the buzz too, because this medication is specifically Wegovy, that was FDA approved for weight loss adults, is now FDA approved for ages 12 and up for kids with a BMI greater than 95th percentile. So we're really excited about that. The research outcomes showed just very safe and effective weight loss for this being a tool to use with lifestyle management.
Awesome. So there's no quick fix to losing weight, as you and I have discussed. So, some people in the media are kind of looking at that drug as maybe a quicker way to do so. But could you talk more about how, like you said, it's one tool in the toolbox and it's not going to be a cure all for everybody?
Yeah, and unfortunately, I think that is a quick fix message is going around about like, oh, I just need this medication and everything will be better, because that's what the celebrities unfortunately are kind of promoting. But like we said, this is a tool, and the foundation to better long lasting weight loss is lifestyle management first, in terms of like making better eating choices, more activity, better sleep, better mental health, and better behaviors and choices overall. And that's specifically what our Spark team does, is help lay that better foundation for healthier choices. But then when you add a tool like a medication on top of that, it really just works together to get much, much better outcomes. And I think a lot of people don't realize, when they hear the statistics for how much weight loss this medication provides, they also don't hear that most of the times in these studies, the medication was used with a lifestyle program too. And so that synergistic effect is why they see a lot of weight loss, rather than just not making any lifestyle changes and using the medication. So it's with combination lifestyle program is why these medications work as well as they do too.
Mm-hmm. Yeah. So we have one more question here for Carly. So if you're watching live and you have a question on anything we've talked about in this live, now would be the time to leave it in the comment section. So how can the Boys Town Pediatric Weight Management Spark Clinic help children and families reach their health and wellness goals in 2023?
Yeah, I think we just understand that sometimes weight loss isn't as easy as just eating less food and exercising more. This can be kind of complex, and there's a lot of guilt and shame, unfortunately, for people who are struggling with their weight, of feeling like, oh, it's a personal problem, it's my responsibility, I should be able to do this. And sometimes they avoid seeking help too because of that shame and their guilt. But we are very understanding that there's a lot more to this. There's genetic, biologic, environmental, social, mental factors that also make weight loss difficult. And so we look at all those things with our expert team that we have to help get past those things. And this isn't a diet plan that we're using. What we do is try to help set small goals, like we talked about earlier, and make small, realistic, lifelong changes that our families can stick with. And so it's more of a better balance with our choices, and being more mindful and present with our choices and our behaviors too, to see better long-term results. And of course, going into 2023, we're really excited about the use of Wegovy, possibly for our patients who are ages 12 and up, to use with our treatment program. But also there's been recent new published guidelines coming from the American Academy of Pediatrics, really having increasing support for the use of weight loss surgery as another tool with a program such as ours. Weight loss surgery is used more for adolescents and teens with more severe obesity, but who also have severe health issues like hypertension, diabetes, liver disease, because the weight loss we see from that really does resolve those health conditions much better than just maybe traditional diet and exercise alone. So very excited.
Mm-hmm. And do we offer those surgeries as options at Boys Town?
Yep. That's one of the tools that we use along with medications as part of our Spark program here for patients that need more of those advanced treatment options.
Mm-hmm. Awesome. So we have one question here in the comments for you. If we receive a referral to the Spark program, what steps are taken / what is the time frame prior to prescribing medication?
Good question. So once we receive a referral from your provider, we reach out and call you to make an appointment and try to get you in as soon as we can. We've got pretty good availability. Just depends on when and what days you want appointments. And usually your first visit is with me, the nurse practitioner, and our behavioral therapist, and talk about the program. And then we bring you back in a couple of weeks to meet with our dietitian and physical therapist. And it's kind of on every month rotation with our team. But we can also see you as much as you want to be seen with any of our specific providers too. Sometimes we get started talking about medications right at that first visit. If that patient's coming in like, I've really tried a lot of different things, I've got a really good handle with a better habits with my choices. And otherwise, if somebody comes in and they're like, I'm not really ready to make lifestyle changes, we might try to work on better choices first and then add in the medication treatment arm once we have that better foundation of our habits. So it kind of depends on the patient and their background.
Mm-hmm. Yeah. So everything's really personalized for the patient, you would say. Awesome. Well, thank you so much, everyone, for watching live. If you are watching this video later on, after the live video has concluded, and you have a question still on anything regarding what we talked about with healthy lifestyle choices, the weight loss injectable drugs, any questions like that, go ahead and leave them in the comments, and I'm happy to facilitate and answer for you from Carly, or you can message our page directly if you'd like it to be private. So please make sure you thumbs up this video, and thank you so much. Carly, have a great day.
You too. Thanks for having me.
Thank you. Bye, everybody.